Last time, we met Jo Cameron, the woman who barely feels pain because one enzyme, FAAH, is turned almost all the way down, leaving her calming anandamide sky high. But Jo herself is not the real story. The real story is what she reveals about a system running inside all of us. I am Dr. Harvey Jenkins, MD PhD, retired orthopedic spine surgeon, pain management physician, and biochemist. Let's dig into this fascinating story and try to make some connections. Because FAAH, fatty acid amide hydrolase, does not clean up just one molecule. It clears a whole family of natural signals. In Jo's blood, two anti-inflammatory cousins of anandamide, including one called PEA, were nearly tripled. And PEA is not a curiosity. Right now it is used to treat adhesive arachnoiditis, one of the most feared spinal pain conditions there is. Doctors give it as a capsule to calm nerve inflammation. Jo makes it in abundance for free every hour of her life. So why not simply make a pill that blocks FAAH and give everyone Jo's chemistry? People tried. It worked beautifully in mice. Jo seemed to prove it in a human. But the clean drugs relieved no pain in the trials, and one poorly built version killed a volunteer in France. The lesson has echoed ever since, proving that a target matters is not the same as having a safe way to hit it. What Jo really hands us is a single idea: endocannabinoid tone. The resting setting of this whole system, turned up or down by how much anandamide you make and how fast FAAH clears it. Jo lives at the far high end. The rest of us sit in the middle, and our tone moves. Stress wears it down. Grief can overwhelm it. And when our own supply falls short, many people reach for the plant that hits the very same receptors. In 2021, sprinter Sha'Carri Richardson learned of her mother's death days before the Olympic trials and used cannabis to cope. THC is, in effect, an imposter anandamide, borrowing the very same lock. A positive test cost her the games. Look at the two together. Jo's tone, turned up by birth, quiets fear and pain. Sha'Carri's, overwhelmed by grief, sent her reaching for an outside key. Same system, same receptor, opposite ends of one dial. That dial is inside you too. Learning to read it, and one day to adjust it safely, is how the next generation of pain relief gets built. Stay curious. Stay informed. Learn more about this story and other medical mysteries on unbedsidemanners.com. Educational content, not medical advice.